I'm Bev Sebastian, and I'm the Executive Director of Island Hospice and Healthcare in Zimbabwe. We opened in 1979 as the first hospice in Africa. Here at Island, we envision a Zimbabwe where people access quality palliative and bereavement care to treat suffering and pain and improve the quality of their lives. As we approach World Hospice and Palliative Care Day, I'm pleased to talk to the members and supporters of the Worldwide Hospice and Palliative Care Alliance about this year's theme. Do not leave those suffering behind, palliative care and universal health coverage, and what it means for us here in Zimbabwe. As a palliative care service provider, reaching the poorest and most marginalized is a key part of Island's work. With an underfunded health system and palliative care mainly funded and provided by civil society, we're a long way from universal health coverage of palliative care, despite the extensive need and our hard work to date. Health facility user fees remain beyond many Zimbabweans, meaning that people do not access the health care that they need, or they face financial hardship if they attempt to do so. Palliative care, unfortunately, is rarely provided in health facilities, and many people are simply told that there's nothing more that can be done, and they're sent home. Very few oncology doctors exist for the whole country, and 1 in 4 children are orphaned in Zimbabwe. We know that unresolved grief and bereavement, which these children may experience, may lead to substance abuse, depression, risky sex, which we know leads to HIV, and other difficulties. So many people are being left behind. But in Zimbabwe, we're working really hard to change this. The government has committed to achieving universal health coverage as part of the Sustainable Development Goals, and palliative care is an essential part of the health service spectrum. To achieve this goal, we need to focus on 3 areas. Number 1 is cost. We want to build the evidence to show what our services cost, their cost effectiveness, and what it costs not to provide palliative care to the population. Number 2 is count. We want to work with partners to look at how coverage of palliative care is measured and how you ensure the most marginalized and poorest are reached. Number 3, care. We are building our capability to ensure that quality care is provided to all who need it, and we can show the positive outcomes in people's lives. As we celebrate World Hospice and Palliative Care Day with the Ministry of Health and Childcare in Zimbabwe and our palliative care colleagues in Zimbabwe and around the world, we look forward to increased collaboration and partnership to make universal health coverage of palliative care a reality, both here in Zimbabwe and globally. What gets measured gets done, so let's together set strong measurable goals for palliative care for 2030 and make a radical difference to millions of people's lives. Those suffering in need of palliative care cannot be left behind. Thank you.